He revolutionized modern orthopedic surgery with pioneering reconstructive, replantation, and microvascular surgery procedures. Patients came from around the world for his expertise in hand, elbow, and hip surgeries, and he trained many of today's leading orthopedic surgeons. James Urbaniak is without debate a global icon in orthopedic surgery.
In addition to accomplishments that are, to many of us, almost immortal, he cares about people.
Patients first want to know how much you care before they know how much you know. And I've always felt this was very important.
Dr. Urbaniak launched reattachment and microvascular surgery at Duke in 1973 when a teenage boy lost his thumb in a boating accident.
And went to the bottom of the lake, and they sent 8 skin divers down. They retrieved the thumb and flew it back to Duke in a helicopter, and we successfully reattached it.
With that surgery, Duke became just the second medical center in the country to perform an extremity reattachment. News spread fast, and about 3 weeks later, a young man from Greenville, South Carolina, lost a thumb and pinky in a machine accident.
And they were getting ready to throw the thumb and a little finger in the waste can. They saw a newspaper at the bottom of it and said, "Hey, they're reattaching these up at Duke." So they flew him up to Duke, and we put his thumb and little finger back on.
The family was so grateful to Dr. Urbaniak, the father showed his deep appreciation in a most curious way one Saturday afternoon when
Duke was playing NC State out here. We had a running back named Troy Slade. He caught a punt, and he ran through the whole NC State team for a touchdown. But they called clipping on Duke, and the head official was the father, and he waved he waved the clip off. And that was the greatest reward I ever had in my whole medical career, really.
Before long, Dr. Urbaniak was sought out by patients around the country and eventually the world. He became the international leader on ischemia reperfusion, the vital reestablishment of blood flow through reconnected vessels.
That's an amazing thing to see a sort of dead-looking white piece of tissue that begins to pink up within minutes of reperfusion.
And when it doesn't flow, based on the work he's done on ischemia reperfusion, we know what to do, we know why it's occurred, we know what the problems are.
He pioneered the work of replantation, but it was through his clinical and his basic science research that became such a powerful force at Duke.
Perhaps Dr. Urbaniak's greatest surgical innovation was pioneering the use of a section of the calf bone to regenerate hip joints damaged by disease.
We'd take a piece of the fibula, which is about as big as your index finger, and take that along with an artery and 2 veins. We connected the vessels in the hip region to that bone we transplanted up there to bring the femoral head back to life.
Based again on his work, we were able to use the fibula for general orthopedic microvascular applications.
It's just a fantastic idea, and Jim perfected the art of it.
Dr. Urbaniak was born in the small coal mining town of Fairmont, West Virginia, where as a child he overcame a severe bout of rheumatic fever.
I was ill for quite a while, and actually a doctor, Dr. Joe, came to see me every day in my home for 3 months. And that was the major influence of me going into medicine.
He was valedictorian and one of Fairmont High School's most accomplished athletes in football, basketball, and track. Legendary football coach Paul Bear Bryant recruited him to the University of Kentucky. Shortly after, Bryant left Kentucky for Texas A&M and tried to take Dr. Urbaniak with him.
But I decided I wanted to stay and go to Kentucky where my father had gone.
At Kentucky, Dr. Urbaniak was an academic All-American and the fastest player on the football team for all 4 years. He earned a medical degree at Duke in 1962 and performed an internship and residency here as well. Part of his residency included 2 years in the U.S. Navy Medical Corps in Washington, D.C., where he served as the attending physician to the U.S. Congress and Supreme Court. He joined the Duke faculty in 1969 and was greatly influenced by giants in the field of orthopedic surgery, Lennox Baker, Leonard Goldner, and Frank Bassett.
Bill Anlyan, who I'm honored to have the award it's named after him, also had a great influence on me, and he was very helpful in my selection and certainly supported me going into orthopedics. So I've always been grateful to Bill Anlyan for that.
Dr. Urbaniak was president of 11 national or international orthopedic or hand surgery organizations and authored 13 books and more than 300 scientific articles. Renowned orthopedic surgeon Panayotis Soukakos of Athens, Greece, summarized Dr. Urbaniak's storied career when he said, "There is not a single young or old microsurgeon, hand surgeon, or orthopedic surgeon in the 4 continents that does not recognize and acknowledge the name, contribution, and impact of Dr. Urbaniak in the field."
I think Jim really is the international face of Duke, as well as this tremendous mentor and friend to so many people.
Dr. Urbaniak praises his life partner and wife, Martha "Muff" Schauger Urbaniak, for much of his success.
Muff was a Duke nurse. She went to Duke Nursing School here and worked in Duke Hospital and taught, and has remained very involved with the Duke Nursing alumni. She loves Duke as much as I do.
They have 2 grown children, Michael, who works for a sports media company, and Kathleen, who's married to a U.S. Air Force officer. The Urbaniaks have 1 grandson. Dr. Urbaniak has been to more than 80 countries to give lectures, teach, or to perform operations. Muff has been able to travel with him most of the time.
I know I speak for all the residents and fellows who have trained under him, and truly this is not a Bud Light commercial, but Jim, we love you, man.